Good morning. Welcome to the Inside Job Podcast, Healed Inside Out. This morning, I have with me the returned beautiful Miss Nasa. And joining us this morning is Dr. Johnson. Dr. Johnson is a gynecologist, and he's going to talk with us this morning about menopause. We're going to go into the subject of it, which is going to kind of filter into some other things, because I do want to talk about the effect of mental health with menopause, because I think that it's missed. People don't understand like where menopause, when we're in menopause, where that takes us sometimes, and sometimes without the proper medication, vitamins, or whatever, you lose it.
You're suffering.
You're suffering. So that's what our topic is going to be today. The doctor's going to give us some good tips, nuggets, talk about it, because we are affected differently because of our race and things like that. So you're the subject matter expert with this, so
Okay.
I'm not going to share too much about it because, but I know I've learned some things in just meeting you. I just met Dr. Johnson, and he's saved my life. Me too.
That was an assist.
Assist, yes.
The lady to
yes.
my right helped save your life by introducing you to me, and we had a good conversation about where you should be. And I like the way you teed it up about things we don't know about menopause.
Mm-hmm.
It's like a dirty little secret of what menopause actually means and how it reacts to people, especially mental aspects of it. So.
And you know what? I also think that, and I'm not sure if you're going to touch on this, and it may be out there, but the understanding that the men should have, like our spouses and, our sons or whatever, because they need to have some patience, right? There's some support groups for the men out there, because they catch it, right?
Yeah.
They catch it. I have to tell you a story. So, I am in menopause, and I had the fan on. Well, it was winter, and so I was like, cut the fan up. and he was like, it's cold in here. And I'm like, no, it's not. It's hot. And instead of me saying it's hot to me, I just kept saying, no, it's hot. Turn it up. And he was like, but why? It's cold. And I kind of snapped a little bit.
Yeah.
I think they need support.
Don't use the word snap.
Yeah, okay.
You have some rough edges.
I have some rough
and
edges,
they need to
y'all.
move back so they don't get a paper cut from the edges. Because you realize menopause is a natural kind of a response to life. You go through all these phases, and people look at menopause like I got a death threat. No, you it's a part of your development. So you go, it could be puberty, then next thing you go to the viable periods of your life, then you start premenopausal, menopausal, and postmenopausal, thinking that this is something abnormal. This is a normal. We just have to look at it in that fact. We can't say, okay, this is abnormal. Let's throw everything we can at it and potentially give you drugs that's more harmful. And the side effects of those drugs, trying to treat a normal entity, because we don't take the time to understand it.
Ooh, that part. Yeah.
I'm talking about doctors.
Yeah.
And healthcare providers,
So what is menopause?
Well, menopause is basically defined as not having a menstrual cycle for a year, but it really indicates the reproductive part of your life has ended, which means that you're not producing eggs, you're not, again, menstruating, and then you also realize that your hormones begin to change. Estrogen goes down, progesterone goes down, and then you have to realize that that's a phase. So you go to premenopausal, which occurs usually 10 years before menopause. So menopause is actually presents itself between 45 and 55 in general, but in African American women, it appears a lot later.
Later.
Like you may see 51 to 60, and normally definitely about 57. But there's subtle signs that you know you don't have to be in menopause before a bell goes off to say, you know what, this lady needs some assistance, and there's some adaptive lifestyle changes she could undergo, as opposed to saying, okay, now let's put you on hormone replacement therapy and see you in a year. That doesn't work in most cycles, because you need to sit there and understand menopause. As a physician, you have to do one thing, and that's being a good listener. And you know how you become a good listener? Don't talk.
Pin that.
Pin that.
Now, as a doctor, I found myself interrupting the patient every 18 seconds trying to get her on the line of subject matter that I wanted her to be on. I was listening to what I want to hear, not what she was saying. So this is a phase of my career where now I'm able to talk to patients. And I know I had some patients said, Dr. Johnson, you've been on the phone a long time. You got to go. I said, I don't have to go anywhere. I'm partially retired. What else do you have to say? I'm listening. And that's an opportunity for once in your life. You got a doctor who's going to sit there and listen to the words that's coming out of your mouth.
And that's correct, because, a lot of times we're numbers. Right, so while I go into my doctor, I'm telling what's going on, and they're trying to get me through, for the next one to come in. And I've often left feeling like, did you even hear what I had to say?
Yeah.
Right. If I could kind of interject as to how I tracked Dr. Johnson down, I had an old school doctor that was similar to how Dr. Johnson runs his practice. They examine you, the nurse comes with them, and that whole bit. Well, he passed away.
Okay.
And so I got some information from other ladies, and I thought, okay, I'll try a female doctor. And went to this lady in particular and was telling her what my situation was, and, told her everything that was going on with me. And she put me on birth control at that time. Now, I've already had my kids, I'm done, but she put me on birth control. And me having the trust in the previous doctor, I extended that trust to her, and I shouldn't have. And so I did what she said, and in about 3-4 months, I had gained 25 pounds.
Yeah.
So I call her back, and I say, hey, I'm gaining weight. And she says, well, it sounds like you're a little depressed, so I'm going to put you on some Prozac. I said, no, you're going to put my file at the front desk, and I'm going to pick it up. And that's when I started looking. I had heard about Dr. Johnson, but I tracked him. I thought at the time he was at Rose, but he ended up being at, where were you, out south, way out south? Was that Porter?
Porter?
Yeah, he was way out there. Worth every minute of the drive.
Yeah.
But, I just made up my mind. Like the saying goes, you have to put your health in your hands.
Yeah.
And I knew going into this lady's office, you could see it was like she was thinking about something else.
Yeah.
She wasn't really hearing
That's
what I had to say.
unfortunate.
And then for me to tell you, I'm depressed about 25 pounds, but I want to know why.
Right.
I want to know what's going on with that. And then
Absolutely.
for you to want to put another drug on top of that, that let me know you're not trying to hear me, you're not listening, and you're not truly concerned about my well-being.
Yeah.
And so when I did find Dr. Johnson, I tease you. I let her know your story. One day he came in, there you are laying on the table. You got your girlfriend there with you. He walks in with a muffin.
You want a muffin?
That's just what he said. He said, you want some? He took a bite, said, you want some? I'm like, no, I would like to get this over with, please. But that's just, his warmness and, how he makes you feel. And then he always encouraged me. He said, you know what I like about you is I come in there with a list. or whatever is going on with me, I come in there with a list, because doctors don't know what's going on with you unless you give them the pathway.
Right.
So.
Right. Yeah, that story tickles me. I'm trying to pull it together so that I ain't sit up here slapping my knee. But that's hilarious on so many levels.
But let me interject this. We were talking about defining menopause, and you brought up a good point about the mental aspects of it. But if you look at menopause, there is a physical component, and then there is a mental component. So if you look at some of the physical components, it could be something as simple as women have dry vagina, and sex is impossible. The conversation they don't want to approach. And I had a lady, she said, I feel very uncomfortable talking to you about that. These issues. I said, so who are you going to talk to? Your pastor?
Right.
I think you here, and let's get this over with.
Yes.
So then you look at her, and she just looked on edge, because some of the emotional components, the mental components would say she can't sleep.
Come on.
Yeah, say she has mood swings that nobody understand, and say she has back to physical hot and cold flashes, night sweats.
Yep.
So, in my experience, 80% of the cases of menopause are diagnosed by patients. You come in my office and you go like, well, that could be this, it could be that, it could be that, and then take these hormone replacements. But you don't know whether there's a thyroid disorder. There could be something going on hormone other than change of life. Lady could have other problems, but we just don't take the time. It's like a doctor's bam bam. Thank you, ma'am. It's like we talking to you with one hand on the door.
Yeah.
So like Nassau said, you got to come in prepared.
Yes.
And that's one of the things I try to tell patients: come in prepared.
Yes.
What questions you need to ask the doctor or the practitioner, and let them know I will be heard. Don't shut me down trying to get me to the next step when you're paying the money to see a provider, and then they're going to treat you in that way. I think you just need to realize that if he's not listening, doing multitasking, then you just say, excuse me, doctor, I'll wait till you finish.
That's good advice.
Yeah, I don't want your undivided attention.
That's right.
That's good advice, because it's your health. You know, I'm talking about me, right? You thinking about what's in the skillet. But you know what? So you mentioned that because last night I'm struggling sleeping with my menopause. Not so much because of the hot flashes and just the night sweats. I just felt like I couldn't shut off.
Yeah.
You know, like my head. And I'm tired.
Yeah.
I was tired. I had some tea, some sleepy time tea, and I was like, I'm gonna relax myself. And I laid down. I still just couldn't sleep, and it's so frustrating, right? I did not know that the lack of sleep was even part of menopause.
Oh, yeah.
Because my daughter didn't share that with me.
Yeah.
I didn't get that until, like after I spoke with you, and I've been in this thing because I had a full hysterectomy. I had some fibroid tumors that were just monstrous. So they took everything. So I actually got tossed in a little sooner into menopause. But my doctor didn't share with me all of the side effects or what to expect. And so to Nissa's point, they're like, oh, depression, here's this. Oh, okay, well, you got this, and now you got that, and you got this. But it seems to be all related to the menopause. Those are all the same symptoms, but they're treating all these symptoms individually.
Yeah, but if you are an astute provider, those symptoms was probably appearing when you were in the perimenopausal phase. And you ever heard the concept of kicking a can down the road? Because I don't want to take the time to go into this whole dissertation on menopause with you, because I got 5 people in the waiting room, and I'm going like, if that's me, I said, can you get the 5 people in the waiting room a muffin or something? Because I'm talking to you right now. Right. And they'll get their due too. But oddly enough, you hit insomnia. It's one of the first symptoms that occurs in a perimenopause
My goodness.
phase. And then what we do is give Ambien, Halcyon,
Yep.
like Nasasa. We give you think you're depressed, let's give you Halcyon. Prozac. Okay, I think you having bladder problems, let's give you something to help your bladder.
Yes.
Okay, you have this and that, and you come out there on 10 different meds,
Yeah.
and you try to treat one entity
Yes.
that you're not paying attention, because you can make that diagnosis and treat it, and you can treat it in a natural way. And I could talk about that later on, about some of the things that I've been
Okay.
doing naturally, because I think that when you start treating patients, primarily like you had a surgical menopause. So that's like being on drugs and someone said, now you're going to go cold turkey. So you go straight into the menopause. There's no period that you kind of transition into. But I think that if you look at the causes that related to, what is in your case, women who have cancer, we give them chemotherapeutic agents at breast cancer, next thing you know, in the menopause. Women have premature ovarian failure. And I had a lady who was 13. And then another lady who was maybe 30s. But the key to it is that it's not menopause. There's a secondary reason why that person's been thrown in menopause. So it requires a workup on the doctor's part, listen to the patient, see when it's happened, and then you can find out that there are some things you can help. Now, her hormone replacement at 13 or 30 is necessary.
Right.
And you do it for a particular time, because there's no cure for the menopause. It's just a part of life. It just transitions to one phase or the other. But it's how you want to control symptoms. So I don't treat blood work. And I'm really not treating symptoms per se. I'm treating the patient. And oddly enough, I take care of patients, Black, white, Hispanic, Asian, and there is a difference. And it's culturally, and oddly enough, I was talking about some dietary things we can do to help ameliorate some of the symptoms, so it won't be so hard. So all of a sudden, I was telling this one lady who was happened to be Black, and she said, I said, you have to not eat a lot of spicy foods, cut back on caffeine, cut back on starch, and cut back on this. She said, brother doctor, how you expect me to eat? He said, in essence, do you tell a Chinese person not to eat rice?
Yeah.
Do you tell a Mexican? I said, this is education for me. I'm listening. Go ahead. So we come up with some schemes on how you modify, and then you realize that you eat kind of who you are. So for me to tell everybody to eat fresh fruit and vegetables, where that come from? Did I make that up?
Yeah.
You gonna look at me? No.
Right.
But we come up with some dietary changes that help with the menopause, and we can talk more about that when you come to maybe some treatment aspects.
Okay. Yeah, you know what? And again, I had no idea what not to. I wasn't giving the what not to eat and what to eat that help it, and what not to eat that hurts it. That adds it on. And I love spicy food, so I'm eating. I got my Frank's hot red hot. I'm putting that on everything. I'm eating all that I'm not supposed to have, and then I'm suffering. It wasn't until I did obviously some of the research on my own as well, which is important. You have to do some of the research yourself. So that you have an understanding, and so that I can come to you and say, hey, you know what, this is what I'm going. And then when you give it back to me, I can relate it to my own, understanding.
But that's not your fault. As a patient, that's like us blaming some of these young people for their behavior. It's like, did anybody tell them not to go that direction? It's like women come in just like lost and not trusting the healthcare system, because the healthcare system is not to be trusted.
Yep.
And then you come in, it's like you are given like a cookbook diagnosis, or either it's like they could take the time just to give you one key point per visit that you can work with. But when you come in, and it is upon you, so I applaud you for that. So if you truly want to get the best out of healthcare, you have to be your best
Advocate, no question.
for yourself, and
No
that
question.
that requires learning, reaching out, touching, talk to other women in the community. It's just that the doctor is limited in scope because a lot of that stuff we didn't get. We kind of make it up as we go. You know what I mean?
Yeah.
It's like
Scary.
I think I'm depressed. Okay, take some Prozac.
Yeah.
It's like, why are you depressed? There's something else
Right.
going on in your family,
Yes.
dynamics, because
Right.
stress and anxiety will heighten the symptoms of menopause.
Absolutely. I was going to say, one thing I appreciated about Dr. Johnson, for those of you in podcast land, if you're looking for a doctor, what I appreciated about him, when you talk about body, mind, spirit, so to speak, after Dr. Johnson would examine you, then he'd have you go into his office. Because I realized there's a lot of times there's a correlation with your physical
Okay.
and what's going on with you mentally.
Yeah.
He can pick
Yeah.
up on those kinds of
Right.
things. So if
Yeah.
you have a doctor that is, once like he said, slam bam, thank you ma'am, you
Right.
just in there, okay, bye, see you next time, that'll
Right.
be $40.
Yeah.
Right.
You know what I mean? You really want to try to find someone, but he would always have you go in his office because he's looking at your chart, your blood work, and so he gets to talk to you a little bit and kind of see, is there something going on in your life that is creating what I'm looking at here in this blood work? And so that is something important when you're looking for a physician. You know, you want to see some elements that are in play to let you know if this individual is truly about your well-being and your health.
Yeah.
Right.
And one of the things that I try to do is like have phases in the visit where you come in, I introduce myself to you and so forth. We talk with clothes on. I remember I walked into a patient's room once. She was sitting there in the raw, or in the buff, I guess you call it. And I'm going like, so I hope you're not here for a sore throat. So I said, nurse, get in here. And I said, you have to be dressed. I mean, don't take
Yeah.
advantage of me that way.
Yeah.
She said, well, I said, I care.
Yeah.
And so the
That's
next phase,
good.
you do the exam, and then you go into the exam room, no, into the office, and I have a pad and a piece of paper,
Okay.
and I try to. It's called teach it forward or whatever, teach back. So I'm telling the story, and she's writing it. I said, so what did I say to you? And she said, I said, I didn't say that.
Wow.
So it's
perception.
her perception of what I was saying.
Yes.
Because I was probably talking too fast
Okay.
and talking in a medical jargonistic term that she would not understand. So I'll really kind of advise people to bring a chaperone with you. But sometimes it's a lot of information.
Yeah.
So, it's just the way I do it. But it's not going to be done that way unless you insist the time.
Yeah. So I mean, which goes back to you have to be your own self advocate.
Absolutely. Absolutely, you do.
And that's good advice too, especially when it's something that's very serious. I remember going to the doctor with my mother for she was diagnosed with gastric cancer, and I went to the doctor with her. The first time I went, I didn't have a notebook because, I thought I was just going to hear it all. But then I caught on quickly that, you do need to write some stuff down
Right.
and she's engrossed in it. She's got the emotional piece part, so she's not necessarily hearing everything that they're
Right.
saying. And then I'm writing stuff down, and then I'm that one that does ask a lot of questions. And so I would have to ask the doctor, so what you mean by this? And what does that word mean? Because we don't understand the medical
Yeah,
language.
jargon,
And
Yeah,
why what is this? And why do you want me to take it?
Yeah.
Yeah.
You know what I mean? Just
Yeah.
don't just hand me a prescription, tell me to go get it, and I don't know what it is. I don't know how it's going to affect me, what the possibilities are, any of that. So
Right. So, doctor, are there ways to, I mean, I know it's not curable, but do you have to take the treatment plans, the hormone treatment plans, or are there just like a vitamin concoction or something like that you can take naturally
No, it's not
to
a,
help?
a vitamin concoction. It's nothing. It's just that if you realize that everybody who goes through the change of life, you can go through it smoothly
Ooh, that's
without
good.
any particular side effects that's debilitating,
Okay.
where you can't sleep, you're sweating, you have 100 hot flashes a day, you say you're moody at home. I mean, just a plethora of just symptoms. Now, of course, the people who go through premature menopause probably need some support for a period of time. And as odd as it's kept, women of color do not need to take hormones unless they have some specific symptoms or specific disease, like, okay, your bones may become weak, osteoporosis, or either you worry about like heart disease. Now, if you look at hormone replacement and look at the advantages other than lessening the symptoms, it has shown that certain hormones like estrogen is cardioprotective, which means that in your 50s, no, before that, your heart is protected by the ovarian enzymes that's been produced,
Oh,
estrogen
wow.
and progesterone.
Okay.
So when that's gone, then next you know you kind of put it at risk, but it's not like at risk to develop anything unless you just don't do anything. So then we say, okay, let's concentrate on things that we can give patients from a natural point of view, adaptive lifestyle with a diet, or either just some exercise, walking, and then see how that works. Because I have known that the hormones that I have given patients, if they have weak bones, they help replenish the bones. But it's not like it's meant for you to take it for the rest of your life. It's just for that period of time. You can check your bone. And then I just see people who, it's like the quality of life. Now, granted, you got a male doctor telling you about how to have a baby, how does it feel, and hormones. I don't know none of that stuff because I ain't had no baby. If I would have a baby, no, I'm not going to say that. But I tell you what, birth control would be the law. I mean, like, I wouldn't be. You guys are strong to go through that, and then you go through the change of life, and you assume it's okay because no one takes the interest to say, let's try this. Let's do this, as opposed to let's, like you say, take a pill to go, and then all of a sudden you come back and, oh, you're doing okay. You have any symptoms? Not really. Well, take it. If you're not feeling well, let's double the medication.
Yes.
Not realizing the side effects of the medication can be, especially in a small group of women, breast cancer or hormonal replacement, and also deep vein thrombosis, clots can develop from that. And actually, you could consider the adverse effect it has on just different organ structures. Because if you realize that women at risk for like dementia should be on some form of hormone replacement. Because all of a sudden you realize that the estrogen supports the brain, the heart, the colon, any tissue. Like you get to change life in your skin and gets thinner. Now, that's not primarily women of color. But if you go around, you see white women and you see all these blood vessels popping, bruising. The lack of estrogen, the skin gets thinner. This gets richer when it comes to color, what is sun. We get kind of like, not a tan, we get blue black. I mean, it's like a deeper, richer color. And the thing is, that's why.
I don't know about me, Doc.
You're okay.
I don't know.
Yeah. That's why we require less hormones. But don't go into change of life thinking you need hormones. If you're going through a phase of your life, what you need to do is make sure you have the adaptive lifestyle changes, whether it's diet, exercise, eating better,
That's
taking
good
better care of
advice.
yourself. Then you're better off.
I have a question, Doctor. What is it, or do you know, as to why Black women start this process a little bit later? Is there any research?
No, I think it's research is that we have melon as well as estrogen and progesterone in our bodies, and the fact that we just have more, so the hormonal variations tend to wax and wane, but go down longer. I mean, over a period of time. You can have a stay with the estrogen levels will linger, but symptoms, you want to have symptoms. So if you came in my office and say, well, I think I'm going to change your life, can you do a blood test? I said, yeah, blood tests show that you're in a change of life. Do you have any symptom? No. I said, well, let's do this. Let's do some supportive things. What is calcium? What is vitamin D, vitamin D3? What is phytoestrogen, herbal things that you can do. But don't go straight to an estrogen because you, by definition, are in menopause. You know what I mean? It's just that, but you're not a definition. And you're not a protocol. You're a person and should be treated as such. And normally, just listen to patients, and actually, if I give you anything, it's strong recommendations and suggestions. And you're going to be part of the decision-making process after I've given you all the information. Not just have you just, yeah.
Oh, that's good. Yeah. So why is it that some of us get it and some of us don't? I come across some women, they're like, yeah, I've never had it. They're older women. They're like, yeah, I've never experienced any of it. So why is that?
So was that a question you're asking me?
Yeah, like why is it
Cool.
that?
Why do some people get cancer and some people don't?
Yeah. Well, I mean,
if you don't, that's just a blessing, and just basically how you take care of yourself throughout your life, how you eat the rest, and you're mentally, psychologically stable. It's like you're in a good place in life, even though you had a hysterectomy. You go like, well, that's hysterectomy. I had fibroids. It's like the next phase of your life. What's the next avenue? You can't get stuck and stagnant,
right?
And different, because your life should be more fluent,
right?
Kind of like going through it, and if it doesn't happen on this end, and if you take care of it, it's going to happen on this end. You just have to be prepared for it. But a doctor should be there with a health plan year by year to say, this is what's expected, this is what I want you to do. You should have some goals, but we're not there because I don't think we know. I think this is ever changing. It's very complicated because if you look at all the symptoms of menopause and perimenopause, it's unbelievable that how important estrogen is to women, and for maintaining their brain, their integrity of skin, mind. And then we just go like, well, let's go ahead and, since you interchange life, let's give you estrogen, without realizing some of the horror stories that's happened with estrogen. And then, but you don't screen. If I thought it's going to cause you to have breast cancer, I would have you do breast exams on a regular basis, get your mammogram done yearly, and then talk about how long you're going to be on this medication before we can transition you into something else a little safer. Because there's other medications a lot safer than traditional hormonal treatment, which is estrogen.
Man, that's such good knowledge for to put out there, because I didn't know that, and I just didn't. I didn't know that, and so my kids don't know that. So now I'm getting ready to go. When I leave from here, I'm gonna be on the phone, because just sharing that information. I had another guest that spoke about if you don't know it's a battle, you can't prepare for it.
Right, you can't prepare for that.
And so that's what that speaks to, just right here, right now. If you don't know that you need the estrogen, and that helps with your brain and all of that. Wow.
I've got a question, doctor. Is there any type of correlation? I just had a mammogram, and they ask you, when did you start how old were you when you start your menstrual cycle?
Right.
And it seems like this is just me, but it seems like they're getting younger and younger and younger. I know a young lady started at 10. So
Menopause?
Yeah, no, started her menstrual
Oh,
cycle.
oh,
at
okay,
10.
okay.
So
okay.
is there any kind of correlation between when you, because I've noticed that they ask the question. So what would be the correlation between when you started your cycle and then the rest of it? Or is there any type of correlation?
Well, there is a correlation, but it's just very subjective. It's not like a scientific proof. But I think that the earlier you have the onset of your menses, then it's logical the earlier you can go into the change of life. But you have to realize that in the beginning was the Word,
Yes.
okay?
Yes.
But women were born. No. Adam came first. This is my story. I'm gonna put a
Okay.
twist to it.
All right,
And
we
then
listening.
and then Adam got lonely. So all of a sudden God said, I'm gonna give you a woman. So this God had to be black, because out of the Adam he took a rib.
Rib. Absolutely.
This is my story, okay? And then
You know how we like
Right.
ribs.
and then all of a sudden
Barbecue.
he was not. They were not supposed to eat of one forbidden fruit. And I was tell a story. My wife used to wonder, you have lost your mind, but a woman compelled man to eat of that forbidden fruit because we didn't know anything about the forbidden fruit. So someone say, so is that the reason why women come in this world having childbirth in pain? My story ended long before that. I don't know, but it's like at the point of a conception of a woman, when she starts menstruating, that sets the system in place off. So in a woman's lifetime, she may have like 400,000 viable follicles or egg to use up. And it seems that once you've used that last egg up, whether it's natural process of aging or either chemotherapy, hysterectomy, then you're actually thrown into menopause. So the menopausal period varies among races and people, but if you're healthy, your change of life is going to be postponed for a little bit because you're healthy. And we say 40 to 55. And I'm saying 47 to 51 for premenopausal and women of color, black. Then after that, postmenopause is going to be delayed up to age 57. So the thing is, you don't look at the menopause as a disease entity. It's just a physiological change. And I should be screening you for that as opposed to you guessing whether you're in menopause or not. So am I in menopause? Let's do some blood tests. And you're doing fine. So the blood test, you treating the blood test or you treating the patient? But to answer that question is, it's all about the reproductive cycle of women. And once that cycle is done, you're not producing eggs, then your reproductive cycle is over with. You can't have babies. And then some women go through the change of life hard. Some goes moderate change and some mild. But you will go through some aspects. It's whether you want to be given a sleeping pill for minor sleep other than I'll work it out myself.
Okay. So I heard you say post. So once I'm in this thing, you mean I got to do it some more out? Like there's a post? I still got to, talk about that. Right. You got the pre, you in it, and then what's going to happen to my post part? Because talk to me.
I think the post part, you should be a little bit more stable, calm. It's that
Okay.
premenopausal is just kind of the beginning, and it could be last up to 10 years. It could start when you're 30, 35 or so forth. So if you look at how it develops, it's how you live your life. So all of a sudden, when your period stops for a year, then you're in the menopause. Now, you can have all these symptoms of mood swings, you can't sleep, urinary problems. You can have a number of problems. You're talking about physical problems. They just mount up because how estrogen affect different parts of the body.
Man.
So all of a sudden, African American women have a little bit more estrogen and melatonin in their not melatonin, melanin in their bodies that will prolong you from going into the change of life. So it's not like you're going to change life hard because you're transitioning into the change of life. So in the postmenopausal phase, you should be functioning normal, but it has to be supportive. Bones have to be supported. Heart has to be
Yeah.
supported.
Yeah.
Colon has to be supported. Your
Yes.
mind has to be supported. Your way of life. So it's not like you can sit back, oddly enough, and say, I'm through the menopause. No.
Yeah. Okay.
Shoot.
When you're in that
Process.
change of life, you're in it for the rest of your life.
Yeah, it's a process.
Shoot. All right. So my bottom line then, because I thought maybe, you got your pre and then you're in it. And because it's so tough for me right now, I just need to go back and do some reevaluation on what I'm eating, which, I don't eat terribly bad. But for some reason, it just seems to have kicked up. It seems that, I'm having a hard time sleeping. I probably have all of the symptoms other than, there's probably a couple that I don't have. I'm not struggling with the sexual part of it, dryness and all that. I don't have any of that particular part of it. But when you talk about bones and, forgetful stuff, the hot flashes for sure. In fact, that's how I got your number, because I called Nasa one day and I actually sent her a little emoji, and my emoji was sitting in a puddle of water with this fans and I was like, I'm losing it, because it makes me irritable, and I'm over it.
Yeah.
You're just wetting everything. You're messing up your bed sheets, and I have to sleep on towels, to keep.
Yeah, that's
And it just seems to have kicked up, and I was like, okay, is this the end of this, Nasa? Like, what's happening here? Because
could be the beginning. So let's play. We could do some. What is it? Role playing.
okay,
I'm the
all
doctor
right.
and you're the patient,
Okay,
and I'm going to tear you apart by pointing out some things you do on a regular basis to make your symptoms of menopause worse.
okay.
Okay, so do you drink caffeine?
I do have coffee.
How much?
Yes.
How
I'm the
much?
secretary. Check.
How much do you drink?
I just drink like a cup of coffee, maybe 3-4 times a week.
Is it a cup or a mug?
It's just a cup.
A cup, like the cup and saucer.
Yes.
Okay, yeah, you got me on that one. What about, do you drink Coke?
No, I don't.
Okay, what about artificial sweeteners? You put that in your.
I use the creamer, international flavor creamer, the vanilla creamer.
Yeah,
Yeah,
in
so
moderation,
I
you could
guess.
you could do that. So how much water you drink a day? 6 to 8 glasses.
5.
So when she thinks, she said 5, it's probably 2 and
Yeah, I'm writing it down, Doc. I got you. I'm writing it down.
Yeah, like,
Yeah, I probably am not drinking as much water as I should, but okay.
So what do you consume, like antioxidants? Like you drink cranberry juice, you do berries, you do any fruit that's going to be an oxygen carrying component to your blood. So we talk about antioxidants.
You know what? I'm really big on smoothies, so I have a lot of smoothies, and I'm probably having 1 or 2 smoothies a day, and I blend those myself, or
Okay.
I'll get them, and they're fruit,
Okay. So are you doing any dieting?
No.
Good, because that's one of our biggest mistakes, trying to do dieting, whether it's paleo, metropolitan,
Yeah.
or no, Mediterranean. Then there's all these different diets we're playing with, not realizing how that affects your system. Because, for example, you do need to have salt in your body, but not so much. Because otherwise, you're looking at developing hypertension, fat and grease you need to cut back on.
Yeah,
and
what's
then you
not
need
there.
to. What do you do for peace? The podcast, is that your peace of life? I mean, do you have anything you do personally for yourself?
Oh yeah.
Meditate,
Oh
pray.
yes. I do meditation and prayer. That's a
Okay.
daily thing for me.
Yeah, because I'm telling you, there is
It
a
is.
direct correlation with the religious component of your life
Absolutely.
and diseases.
Absolutely.
Because I think you can handle things a lot better with just prayer,
Yes.
being calm,
Yes.
peace of mind. But I think that a lot of times you come into the system, you're so anxious to the point where it becomes an irritable factor in your life and makes the hot, cold flashes worse. And then clothing, you need to make sure you have like cotton, clothing at night, and just drink plenty of fluids and go
Okay.
from there. But you did okay,
Okay.
yeah.
Good.
Because a lot of patients, we have to start over,
Yeah.
not from scratch, but start over and things that we need to do to help
Yeah.
ameliorate some of these symptoms because those are things that get you the
Yeah.
symptoms.
Yes, it is.
Yeah. And you know what? So you asked if I was dieting. I'm not dieting, but now that you've asked me that question, I did do like a detox, and it was a 7-day detox where I was just doing smoothies, water, tea. I wasn't partaking of any kind of meal, just other than that, and it dang sure felt like that's when it was.
When you undergo the detoxing.
Yeah, when
Yeah,
I
yeah,
was,
yeah.
and so I was like, I wasn't necessarily dieting, but I wasn't really having my protein. Although one of my smoothies does have some protein in it, but
Yeah, you need protein. Yeah.
and thinking about it, maybe. But for me, and we're gonna talk a little more individually, but mine come so frequently. I've probably had about 15 of them just sitting here. I mean, I just
Hot flashes?
yes, it is. It gets bad.
So
So I'm
what-
having them frequently, and it's driving me bananas.
So you're saying you probably have at least 500 a day?
Yes,
Yeah. So, that's abnormal.
yes, I do know this.
So,
And that's my family. They know it too. Like, what is wrong with you?
that's like a symptomatic emergency. Now, you got my attention. So we
Yeah.
talk about how you get rid of, because when you go through a change of life, the only true symptoms you have are the vasomotor symptoms, and what we're talking to, and when the vagina gets dry to the point where not only dryness but painful intercourse
Oh,
to the point
wow.
where it change your sexual practices. So we can treat all of them and don't have your primary doctor or your OB doctor or GYN say, you got vaginal dryness, let's give you a patch or pill for that. Now, I think the hormone will eventually get to your central nervous system and get to the organ that we're concerned about. But there are other ways to treat it more effectively and naturally. We have compounded pharmacy. We have drugs that we don't prescribe as physicians because the pharmaceutical industry makes more money by pushing said drugs. It's like
No doubt.
if you watch the TV and there's like Ozempic
Oh,
and Wegovy and always for weight loss, and patients don't realize how addicting those weight loss drugs can be, especially that combination, because it affects not only your organ system like the stomach, but it affects the central nervous system. It becomes like an addictive behavior where you need it, and we can't get you off. If we get you off, you tend to lose the weight, and then submerge you and gain it back. And then there's a recent study that showed that Ozempic and it's another one, not Wegovy, causes a couple women have paralysis of their
Listen to the
bowels.
stomach, yes.
Oh,
yes.
wow.
Yes.
So-
That's the new thing.
Right. So if you have gastrointestinal problems and thyroid problems, those are medications you should not be on. But I don't know if the women, due to direct-to-consumer advertising, is coming in and pushing the doctor in the direction they want to go, without the doctor saying, okay, this is a great opportunity for me to talk to you. That drug is not for you. We can have other things that we can offer you that's a lot better.
Okay. Wow, you know what? I feel like, so we got to wrap up here, but I feel like there is so much more to share about it and to give out. Would you be good coming back?
Sure.
Okay, yeah.
And if you're wrapping up today, the fundamental message that I would like to close with is like, woman, know thyself. Know thyself. It's
Absolutely.
like you have to make sure that you go into the doctor's office, you be prepared. You should probably know more about menopause than anybody. Because you should have the opportunity to Google, to research it, and then you're going to realize that, God, this is a big subject. And you can actually get lost by going in the wrong direction. So write your questions down, and then you go to your doctor, and then dismiss some of the fears and sayings they have about menopause and estrogen. That's not true.
Okay. That's really good information to end. Know thyself, and then just with that, do the research on the woman anatomy. Just because we go through different stuff. So yeah.
I had a dear friend in closing. I had a dear friend. You might remember Tony. Anyway, she ended up passing away of a brain tumor, and it started like that January. She started to have all these different symptoms and everything. So by August, really it was like the beginning of September, they finally found it, gave her an operation, and we went in to see her on the 4th after she had the operation. And I'll never forget, she grabbed my oldest daughter was closer to her, and she grabbed her by the hand and she said, learn to listen to your body. It will speak to you. And unfortunately, by the 12th of September, she had passed. But that's just been a lesson for me. Learn to listen to your body. It will speak to you.
Pin that. I know as a doctor, you're busy. Can you come back next week?
Sure. I would like to, if you want to do a series of podcasts, and we pick subjects starting from your mind down to your feet, and everything in between. Because I tell you what, it's that I see a lot of things that's happening in the world today. Medicine is broken, fractured, dysfunctional, and then the only way we're going to overcome, because I said this, when it comes to healthcare, especially healthcare disparity, that's 4 things we have to correct before we start looking at healthcare, and that is the social-economical aspects of it. We can talk about poverty, we could talk about education. The one is inherent racism among physicians who look at a patient and make some prejudgment because
Absolutely.
She's fat, or she got too many tattoos on, she's an alternate sexual behavior, something, without listening to who the person is, and that's what we're here to do.
That's right.
Not judge, but to be supportive.
That's right.
As physicians, so.
Well, I would love that. I would love to have a series.
Pick a topic and we'll just talk it out.
Dive in, because it all matters. It all matters, and I appreciate that. And I wish there were more doctors that were like you, because we need Jews. We need doctors like you.
Yeah, he's the one I spoke of that he said he has an obligation to all women.
Yes.
But especially us, because we are not being heard or taken care of. And that's why I appreciate it. Yeah, that was him.
Thank you.
I think you quoted me correctly, too.
Yes, I did. I remember. Yes,
All right,
I did.
thank you. Well, then, as we go ahead and wrap this up, I appreciate you. Thank you for coming on today. And definitely we'll have you back in a series of conversations to get this message out there. And I pray that you all are listening. Heed to it, glean with it, and take this and live your best life.
Absolutely.
But listen to somebody who cares. Yeah, so I
Yeah.
appreciate you. So thank you. And thank you, Miss Nasai.
You're welcome.
We will talk again. So thank you.